Hi, this is a promotion of nurse well-being through engagement, a quality improvement project by Andrew Denton. I was able to interview Liz Smith, the quality outcomes manager at my facility. She reported back that they've been suffering from delayed bedding times, central line infections, hospital acquired pressure injuries, different kind of quality indicators that can show the culture of the hospital. And upon further investigation, Ms. Smith was able to report back that 24% of frontline workers report burnout symptoms. And this 24% of burnout can be significant in the correlation to these delayed bedding times. You know, if you have nurses that are staffed and they're experiencing burnout, they have a lack of empathy, a lack of motivation. They're going to have delayed bedding times. They're going to have central line infections and hospital acquired pressure injuries. Next is the wellness gap in SWOT analysis. So King et al. In 2021 believes that poor well-being is a significant problem facing healthcare workers and estimate that 40.6% of nurses report burnout. Evidence of the nurse wellness gap at this specific facility include nurses openly admitting to feelings of burnout at least once a week, and managers admitting that they have high rates of nurse call-offs and no-shows and increased number of absences, and those quality indicators remain inconsistent. On the SWOT analysis, some strengths of this facility is it has strong organizational leadership support that want to see our nurses do well and take care of themselves. They have weekly well-being huddles that are incorporated into their weekly huddle meeting. And they have current staff wellness resources, the main one being the well-being committee that is in charge of promoting the engagement and empowerment of its staff members through certain celebrations or opportunities. A couple different weaknesses. They do have a lack of a nurse mentorship program, a large amount of inexperienced nursing staff, and a lack of educator interventions throughout their preceptorship to learn and educate on something that they're unfamiliar with. Some opportunities for this facility is it is surrounded with a patient population of high socioeconomic status and resources. And the facility's association with an academic healthcare center close by. So even though it is a small hospital, they do have the resources and abundance of a larger healthcare system. And then some threats is the drastic changes being made in federal government healthcare policy currently, and our colleagues' non-professional wellness. So how well are our colleagues taking care of themselves outside of the hospital setting? My proposed intervention to the nurse well-being problem is a weekly engagement program. So the weekly engagement program is an opportunity for nurses and managers to meet for 1 hour a week, and they will brainstorm, self-reflect, analyze, envision their nursing experiences, resources, and goals. So this provides them an opportunity to grow professionally and personally, be identified as somebody that is looking for an opportunity to be engaged in their surroundings. It did empower staff members to organize and create creative solutions to the dynamic problems we see in healthcare. It incorporated the frontline workers at in the shared decision-making process. And nurse manager engagement program can impact employee decision-making capabilities, their involvement, empowerment, and overall wellness. And then as well, employee participation in the decision-making process is important in engaging employees and improving their job satisfaction. And then while implementing this program, I'd like to use feedback loops between frontline workers and nurse leaders at existing meetings to reduce the employee burnout by increasing staff involvement in their key policy making processes. And this kind of creates a channel for frontline workers to the organizational leaders. And this channel goes both ways, so organizational leaders will meet and discuss their ideas with the frontline workers, and frontline workers will meet and discuss their idea with the organizational leaders. And through this implementation of feedback loops, it will only give this weekly engagement program a greater opportunity to be successful. Here are a list of references. Thank you, and